Hi, my name is Dr. Travis McDonough, and I'm the CEO of 3DRX Technologies. You can get further information about the company on 3drx.com. This presentation is brought to you in collaboration with Verical Technologies, who is one of our go-to-market partners with this program. And it's for McKenzie Extension Therapies, which has been a world-leading and progressive rehabilitation program that was originated in Australia. 3DRX has three different components to it: a 3D animation component, a rehabilitation component, and a product component. I'm going to first start with a demonstration of our 3D medical animation side, which to date is the world's largest library of 3D medical animations that have been created in conjunction with a world-leading and reputable anatomy and medical program in an academic institution in the United States. The program was created in large part due to a desire to improve understanding for patients and for a tool to be used on behalf of practitioners to make communication more efficient between doctor and patient. The average patient consumes or absorbs less than 7% of information that gets delivered through traditional methods of communication, that is text-based or verbal explanation. That generally goes in one ear and out the other, and that departure of understanding has an enormous implicating effect on patient engagement, treatment adherence, clinical satisfaction with their clinical experience, and ultimately outcomes. And so what we've really strived hard to do in 3DRX was to create digital assets that can be leveraged by the physiotherapist or practitioner of any kind to be used to more effectively communicate to their patient base using rich digital assets that accurately depict particular conditions. This is also and can be specifically applied to many of the conditions that the McKenzie extension paradigm can treat, and that will lead to the second component of the program that we're going to see in a few minutes. But it is an enormous library of 3D medical animations, again depicting commonly seen musculoskeletal conditions, and you get an idea when you just look at the lower back playlist at how large this is, or for example the shoulder. And I'll give you a quick idea of how efficient it is using a common condition seen in the shoulder known as a rotator cuff tear, and in particular this is the supraspinatus that we're showing a lesion in, where we're able to control the extent and the level with the scrubber bar down at the bottom. We're able to use very intuitive drawing tools, and then able to communicate exactly what you want to with text, all of course which can be emailed to the client and sent to them or printed off to improve their understanding. So in this situation, again, we've seen a tear in that tendon that is responsible for shoulder stability. So we're seeing here an upward migration of this bone called the humerus, or the humeral head, that is banging into this fluid-filled sac known as a bursa that can cause further inflammation and irritation, and a compromise in normal biomechanical activity. In this situation here, we're showing how this can lead to an unstable environment and a further taxation of associated musculature, again, which can lead to associated tendinitises, that might be related to the condition. So going back to the low back, we're able to show all kinds of different conditions, and one seen very often in a clinical environment is a disc degenerative state, where we can show, hey, this is a healthy disc, and as a result of this height, or this healthy disc maintains the space here known as the intervertebral foramen, okay, or the IVF. But what can happen just through sort of the insidious decrepitude of this articulation is you can see a loss of disc height here, which ultimately can lead to a dramatic compromise in the size of the IVF space, which can pick off the nerve root and can cause all kinds of pain and radiculopathy down into the leg, and can affect many of the dermatomes. In this situation, we're showing L4 and L5, but we can show, again, any particular area. We can also show the myotomes, or the muscular or nerve roots that supply certain muscles, and what happens if there has been irritation to those, along with any visceral organs that are supplied by those same nerve roots. So we're able to show a whole lot of different ailments and conditions, and going into specifically into herniation or bulges, we're able to again show what happens when the gelatinous material, or the nucleus pulposus, pushes through the annulus fibrosus here, okay, and breaks these lamellar rings that should be there to maintain the gel into its neutral position. What happens though from a lot of forward flex tendencies is that we can again compromise the integrity back here, and the nerve root then can be pushed out and can bang into this nerve root, or it can cause an inflammatory response that can lead to all kinds of neurological and thermal irritation. So if I look at applying this specifically into a playlist in the program, I can show here's what happens when an L5S disc herniation occurs, and maybe there's some associated degeneration that has occurred at that same level, and as a result it's encroaching the nerve root that exits again at that corresponding nerve level. So you can show a patient what has happened. And most of the time, if we were to say these things, it's going to bamboozle them with academic minutia, or that medical nomenclature literally creates this enormous gap between practitioner and patient, and we're trying to eliminate that gap to develop confidence and understanding, etc., etc. So we can also even show mechanism of injury, so showing what happens when someone's forward flexed, and as a result of the tendency to be bending forward, what we're doing is through a hydraulic mechanism, you're causing the pushing of the discal material posterior, which can again cause some deformation of the nerve root. Now, thankfully, there has been some tremendous research done with McKenzie extension exercises, which we can use in our program as well to show to the patient what they need to do, or we can, show again any drawings or delineations of exactly what we want them to accomplish. We can show them the different phases, of what we are trying to make happen, and then of course we're able to put on associated text, and we can deliver that to the patient. So not only showing here's your condition, which will engage them, it will empower them, it will develop confidence, it will establish a tremendous relationship, it'll provide them with an understanding of what they have, but now we're also able to show them what they can do about this in the confines of their own home, or outside the traditional bricks and mortar of a hospital or a physical therapy setting, where they can start to make some significant changes on their condition. And as a result of those exercises, we are able to show them, what can happen, from a pathological condition, and show them the reversal of the etiology, and the cessation, or even again the return to a normal state based on the McKenzie extension protocol, which is certainly something that is ubiquitous in the healthcare space, and is only gaining ever growing traction in the medical and scientific community. So yeah, there's an enormous amount of further information that we could dig down and show specifically about the program, and how we can show underneath the 3D animation library exactly what a condition is, and number two, we can go in and show the exercises as they relate to the rehabilitative protocols for each particular condition. And if any more information is required, on behalf of McKenzie or any particular therapist, then we are certainly able to provide a more detailed demo in the future to highlight how this could relate to the many McKenzie therapists out there who can deliver information that's wrapped in a cloak of credibility using the animations, but also to provide a roadmap of understanding for the patients so they know exactly what they can do to improve their conditions and ultimately to reduce their symptomatology. So on behalf of Vericle and 3DRX, we appreciate the opportunity to show you what we are doing, and we look forward to expanding the relationship with McKenzie in the very near future. Thank you very much.